My name is Dr. Rick Saguil.
And action. Hey, Jay had a... This is Kirk, man. And action. Hey, everyone, it's Dr. Rick. And Heather had a question about anxiety. If this is the first time you're finding me, don't forget to hit the subscribe button down below, the alert button to find out. And if you like this video or you know anybody with anxiety, please share it. And like it. So, the idea that I like to suggest with anxiety is that there's a lot of symptoms that can come up because of a problem with anxiety or anxiousness. And we don't just go straight off and say, everybody's anxious, don't worry about the chest pain, don't worry about the numbness and tingling, don't worry about the altered gait, don't worry about the vision. We always have to, as physicians, look at the individual diseases. Look at the individual symptoms, see if we can link them together to find an outstanding possibility. And that's what my role, or anybody's role as a physician is to be a lifeguard. We go through all these years of study. I think I'm on my 26th year of schooling, which is ridiculous. Now, since residency and fellowships have finished, I've taken a daisy chain of different trainings to modify and produce a knowledge base that essentially gives algorithms to how we can help my patients, because everybody presents differently. But anxiety is so difficult to contextualize because there's so many symptoms, and I'm going to explain why. I use the analogy of a boat with a lot of holes in it. So excuse my artistic rendering, but this is the boat with a lot of holes in it. So I'm going to step out of frame a little bit. There. So this is the boat, and this is the USS vagus nerve. The vagus nerve are the two tiny nerves, they're cranial nerves, and one of 12 cranial nerves, and they come down through the neck. They go around the laryngeal, hit the aorta, and they go down into the belly, down into the anus, actually. But the vagus nerve touches all the systems of the body. So this is the USS Vegas, and as you can see, this boat is trying to get to shore. The shore is controlled mood. And in the ocean of our challenges, there's a panic attack coming. I tried. That's the shark. So in our journey from here in the ocean to there, we will have occasional panic attacks. And when the panic attack occurs, it initiates in the brain this little idea, and it's started in the amygdala. The amygdala is this little almond-shaped part of the brain. The amygdala sends off, it's the alarm. The alarm sends off a message to the hippocampus and the frontal brain, and it says, hey, there's smoke. Watch out, there's a fire. Then that's good if there's a true fire, but when there's no fire, you just smell a little hint of smoke, and suddenly you start to think like a fireman, and you get your stuff on, and you call 911. Probably isn't appropriate, but that's because the brain couldn't shut off the idea. That's a hyper intense reaction to underwhelming stimulus or trigger. So that's the same thing with panic attack, is that sometimes what happens is the vagus nerve will get stimulated over and above the usual stimulation from that part of the brain that's getting the messages to go crazy or overreact. When the vagus nerve gets stimulated, you'll actually have every system in the body that's controlled by the vagus nerve have some kind of reaction. And those are the holes in the boat. So if the boat that's intact is your vagus nerve, and the vagus nerve is well controlled, then no holes. But if the vagus nerve isn't controlled, then it's just a transmitter of the crazy impulses that are coming from this overactive brain. You will start to have symptoms from every system. So I listed them down. You can have I'll just talk about the symptoms: muscle spasm, palpitations, diarrhea, sleeping issues, shortness of breath, numbness and tingling, hot flashes, vision changes, and bladder spasm. So this is the musculoskeletal system, this is the cardiovascular system, this is the GI system. This is usually going to be the respiratory system. Same thing with the shortness of breath, but can also be part of the muscle system, nervous system, endocrine system. That's part of the nervous system as well. And then the urogenital system. So every system gets fired up because they're just listening to the vagus nerve that's firing off every time an impulse comes from the brain. And with anxiousness, there's too many impulses that are coming from the brain. So that's why it's really important to, I don't ignore these holes in the boat, but usually has the duty of your lifeguard. Usually the duty of the lifeguard is to make sure that don't just go straight to, hey, you're just anxious, don't worry about it. We have to intercede and just investigate. So the most important things are to investigate those things that might be indicating sudden death is imminent. So anytime you have, palpitations, chest pain, shortness of breath, numbness and tingling, you gotta worry about the lungs, the heart, and the brain. So heart attack, pulmonary embolism, and stroke. So those are the most important things. And usually even if it's anxiousness causing those symptoms, we'll have to get a stress test or an echocardiogram, a lung test, a chest x-ray, maybe a CT scan of the chest, and then a brain CT or an MRI. So those are the big tests that rule out disease. And most likely, if you have one or many of these symptoms, you've probably had the tests done. But don't feel bad, because usually my patients feel bad when the doctor says, all right, everything's okay. Everything's okay for now, but another hole will come up. So what I usually do is, once those symptoms come up, I would say, have faith, get the rule out test, and then put a squash on those symptoms, plug the hole. So if you have, say, a sleep apnea issue, even if you're not obese or have stuffy nose, big tonsils, if there was a sleep apnea issue found, thank God it's not pulmonary embolism, get the CPAP machine going. If palpitations were found or AFib was found, okay, fine, but use the medicines for the AFib. If numbness and tingling was found, but the CT and MR of the brain are okay, well, take the medicine for numbness and tingling. Gabapentin, Neurontin, a couple of other medicines. So use those things. I hate to say it, but you will be accumulating a lot of medicines. But use the plug of the hole and then move forward. Because if you say, okay, I'm fine, I'm not going to use the CPAP machine, I'm not going to get the heart medicine, I'm not going to take the blood thinner, those symptoms will pop up again, and then you'll have to have, if you go to the same hospital, you might have to have another workup. Or if you go to a different hospital, they'll do the same workup all over again. So if you don't plug the hole and keep it plugged, when the symptoms come back, you might be in the same predicament that, okay, we got to rule out a heart attack with another test. So I would say just be patient. I don't like taking medicines, but in the case of anxiousness, on the journey to get to a controlled mood, I'd say get the workup done, have reassurance that it's normal, but take the treatment. Hopefully it's just one single treatment or maybe two. Take the treatment for those little holes and then move forward. Keep on traveling to shore. The shore is controlled mood. The other non-life-threatening things would be bladder spasm, diarrhea, vision changes. That's more urgent. Sleep issues. All these things are also, they're not life-threatening, but they're life-altering. And if you have them all the holes pop up together, that can be disabling, actually. So, but still, if the diarrhea means that you have to have a stool test or a colonoscopy, okay, thank God it's negative. If the bladder spasm you have to have a scope put into the bladder just to make sure there's no problems, or a CT scan of the belly, okay, it's negative. But every time another system is ruled out as being negative, fine. Maybe take a little bit of the medicine that controls that system in particular and move forward on our way to controlled mood. But obviously the most important thing here is if you have an overwhelming reaction to an underwhelming, maybe this isn't a shark, maybe it's a dolphin. And if it's a dolphin, we shouldn't be having panic attack, but it's still going to be an overreaction to an underwhelming stimulus. for you and I, for people without anxiety, I shouldn't say normal, but people without anxiety, you won't have a overwhelming reaction to a fin in the water. With people who have anxiety, the fin in the water could be an orca, a killer whale, a monster from the deep. If the brain is functioning properly, the brain will say, no, it's probably not that. Reasoning will say, well, turn off the hippocampus, turn off the amygdala alarm system. We'll use the frontal brain and problem solve this stimulus. But unfortunately, some people with PTSD, it's such a shock to the system when the initial trauma occurs that they can't turn off the alarm. So that's pretty much what I suggest for anybody that's going through anxiousness. Oops, sorry about that. Anxiousness is tough. It can be very interruptive. It can be very disabling. So the treatment of choice for anxiousness is psychotherapy because of the problem with the learned. Sometimes there's a tract in the brain, a belief system that's occurring when you're growing up in order to compensate and deal with the trauma, the psychological trauma or the physical trauma that you experience. And sometimes that belief system is difficult to shake off, even as you mature 10 years, 20 years down the line. So, and then you, on top of that, you put on the aging, lower hormones, slightly underactive thyroid, all those things, poorly slept because you're doing 60 hours a week, sedentary life, poor diet. So all those things add on to the already skewed belief system. So it really takes a lot of reversal. That's where I think my psychotherapists are just so fantastic. But as I mentioned in my counseling video, which I'll put a link to down below, I think America is very apprehensive on going to a counselor because you have to divulge yourself to a stranger. And it's a little threatening. I've been to counseling before. I don't have a problem with it, but I think it's very therapeutic. If anything, it is therapeutic, even if the person on the other end of the counseling couch doesn't say anything, they're just there, it's very therapeutic to speak because there's something of a release. Just like there's a release when you exercise, there's a release when you regurgitate your feelings and get them out. There's a release when you vomit. You feel better after too much beer or bad food. So I think it's at the least, it's helpful for getting things out instead of talking to yourself. At the most, that coach on the other end of the couch or at the other end of the room will be able to use their experience of 20 patients a day, 5 days a week, years of practice. They should be able to come up with a design or design a specific way for you to reverse the belief system in the brain. So until that happens, though, you will always be that ship that's trying to find its shore. And it's okay, even if you get only a foot away from the shore, you'll still have to deal with the overactive systems. So don't let those overactive systems, those holes in the boat, skew you or discourage you from continuing on your journey. Patch the hole. Keep your boat where it is right now until the hole is patched, until the treatment is found, until the diagnosis is made that it's not a life-threatening problem with your system. Then you can continue on your journey. So that's the power of the vagus nerve. And there are some techniques, just in the physical realm, there are techniques to calm down the vagus nerve. Sometimes the Valsalva maneuver, where you hold your breath, that'll slow down the vagus nerve. When we have people who have supraventricular tachycardia and they're going really fast, actually there's something called a diver reflex. You take a bowl of ice and water and you put your head in the bowl of ice and water. The reflex reaction is the vagus nerve slows down severely. And that's a cool idea, or it's a reaction. I have done that in the emergency room once or twice. It actually worked. The only problem is if the reason for the fast heartbeat isn't taken care of, the heartbeat just goes back up again. There's also a carotid massage, but that's dangerous if you're older because you might dislodge a plaque and give yourself a stroke. And then there's what Andy Weil taught me, 4-7-8 breathing, because essentially with 4-7-8 breathing, you're slowing down the breath going out, and that turns on the parasympathetic system. It also slows down the vagus nerve. So that's what most of the breathing exercises do, is that. So give it a try to understand where this is going. Hopefully you won't get too discouraged on your way to get to controlled mood. And if you have your own ways that you've had success, then put them down below in the comments. Otherwise, I'll see you at the next Minute Clinic.